My name is John Crouch, and I'm the Clinical Services Coordinator at Behavioral Health System Baltimore, the local behavioral health authority in Baltimore City. Today's presentation will be an overview of the Assertive community treatment and mobile treatment programs in the city. BHSB is a nonprofit organization tasked by Baltimore City and the Behavioral Health Administration to perform the function of managing the city's behavioral health system. This includes services for individuals with substance use and mental health disorders. This slide provides an overview of our vision, mission, and values. As the local behavioral health authority, we help guide approaches to prevention, early intervention, treatment, and recovery in a number of different ways, which include influencing policy development through state-level advocacy, raising public health awareness about behavioral health issues across the city, partnering with local agencies such as the Health Department, Police Department, City Schools, Housing Authority, the Mayor's Office, and allocating resources for substance use disorder and mental health services to Baltimore service providers, primarily through grant-funded programs. To give some context to the larger system that we're a part of, the Maryland Department of Health is a state organization which oversees all of Maryland health services. BHA is a division of the Department of Health, and they oversee behavioral health services in the state. And behavioral health services encompass both mental health and substance use disorders. At the local level, there's BHSB, the Local Behavioral Health Authority, and then we have our behavioral health organizations which provide the direct service in the public behavioral health system. And this includes services for individuals with Medicare, Medicaid, or uninsured individuals. It does not include anyone with private insurance. Our role at BHSB is oversight of the behavioral health providers in the city. And then we have our individuals, families, and communities, the recipients of these behavioral health services. So let's get started on our main topic today, Assertive Community Treatment, or ACT. ACT is a service delivery model in which the primary goal is recovery through community treatment and habilitation. And what differentiates ACT from other outpatient services is that it's an evidence-based practice specifically designed for people with severe and persistent mental illness that are frequently readmitting to inpatient psychiatric hospitals, residential crisis programs, or have repeated forensic involvement. ACT teams are comprised of a team of behavioral health professionals, which include a psychiatrist, nurse, substance use specialist, mental health counselor, vocational specialist, and a peer support specialist. The ACT model incorporates the following principles into the programming. As we just noted, there's a team approach with ACT, allowing for more continuity of care. Rather than referring consumers to multiple programs and services, the ACT team provides all of a consumer's care. ACT provides wraparound support, meaning instead of working with consumers in an office or hospital, they meet with them in their home, their community, or any identified place where problems and stressors might increase. ACT teams carry a smaller caseload than the typical outpatient provider, which allows for more contact with consumers and flexible service delivery. Consumers with higher needs will receive more support from ACT, and there's no standard amount of contact designated for each consumer. There is also no time limit for enrollment in ACT. In addition, 24/7 crisis support is provided for all consumers. These are some of the areas that ACT provides support for. So in addition to addressing behavioral health needs, ACT can also address different social determinants of health. In Baltimore City, consumers can access ACT, FACT, which is our forensic ACT team, as well as mobile treatment. This slide lays out the differences in detail between those programs. FACT utilizes the same model as ACT, but is intended for individuals with forensic involvement. They specialize in addressing criminal justice issues and work to prevent recidivism. Mobile treatment utilizes a service delivery approach that's similar to ACT, but it does not adhere to ACT's evidence-based practice model. Additionally, ACT has ongoing fidelity reviews built into the program, which is not a requirement of mobile treatment. This slide lays out the eligibility criteria for both ACT and mobile treatment. The individual is required to have a priority population diagnosis, which is the cause of significant psychological, personal care, and social impairment. And these impairments result in at least one of the following: clear or current threat to participants' ability to live in their customary setting, or the participant is homeless, an emerging risk to self, property, or others, and an inability to engage in traditional outpatient treatment. Additionally, a demonstration of the inability to form therapeutic relationships on an ongoing basis, as evidenced by one or more of the following: frequent use of emergency room or crisis services for psychiatric reasons, a pattern of repeated psychiatric inpatient facility admissions or long-standing psychiatric hospitalizations, or arrest for reasons associated with the person's mental illness. This slide provides a list of both ACT and mobile treatment providers in the city. Please note that the FACT provider is People Encouraging People, or PEP. In Baltimore City, there is one universal referral form for ACT, FACT, and mobile treatment. Upon completion of the form, it is sent directly to a provider for a review. Providers manage each of their own waitlists and coordinate directly with the referral source regarding the waitlist and if there's an opening. If you have any general questions about ACT, FACT, or mobile treatment, or if you'd like a copy of the referral form, please contact us at clinicalservices2@bhsbaltimore.org. Thank you for viewing this presentation.